60% of Americans are overweight or obese, which means that somewhere between 6 and 12 million Americans are severely obese. We know that obesity is related to major medical problems such as heart disease, diabetes, and premature death. Most people are unsuccessful at losing weight and keeping it off on their own with only diet and exercise programs. And so weight loss surgery can be a tool to help them along that way and really get them those lasting results that they're looking for, not just in terms of weight loss, but in terms of a healthier life and more years to it. A good candidate is somebody who's motivated to make a lifelong change in their health. So we're not looking for patients who are looking for a quick fix. This is not for people who want to lose a few pounds for swimsuit season or an upcoming wedding. We're really looking for people who are committed to a lifelong change, both mentally and physically. And so we use a multidisciplinary approach to help determine that. In addition to meeting with surgeons, our patients meet with a medical bariatrician, who's a medical doctor who specializes in the field of weight loss surgery. In addition, they meet with a nutritionist to help make sure that they understand the eating habits that are required both before surgery and after surgery for the rest of their lives and are committed to those sorts of changes. They also meet with a mental health expert to make sure that they're psychologically stable for surgery, and a bariatric nurse. And only once everybody is on board and feels like the patient is ready for surgery and medically optimized, would we go ahead and proceed. There are some specific criteria to qualify for weight loss surgery. First is the age. We operate on people who are between 18 and 70 years of age. The next thing we look at is their weight, and for that we actually use the BMI, which is a calculation based on height and weight, and something that can be easily found and calculated online. So a BMI of 40 or above is a candidate for surgery, or a BMI of 35 or above if you have any weight-related comorbidity. And those comorbidities can vary with different insurers, but typically include things like heart disease, high blood pressure, diabetes, and sleep apnea. In addition, you have to be psychologically stable for surgery, you have to be medically optimized for surgery, you have to be a non-smoker, and free of drug and alcohol abuse. We know that weight loss surgery is the only method that has been shown to have long-term success in weight loss, but patients can have improvements from other methods. So if it turns out that a patient is not a great candidate for weight loss surgery for whatever reason, then there are some other things that can be tried. Working with your medical doctor in a medically supervised weight loss program, working with a nutritionist to help with your eating habits, as well as a psychologist who can help identify some of the reasons why you may eat the way that you eat. An exercise physiologist may help you get on track and learn how to do some activities that may be easier on your body. Those are all great ways to get started with a healthy weight loss program. In addition, there are some medications that may be appropriate for some patients that can help augment some weight loss. But again, that would be an individually based approach.